Christina. I can restart now. Okay, so I'm Christina. I'm at MS2 at DGSOM, and today we're going to talk about shadowing and clinical volunteering experiences. And we have a few people at DGSOM to answer these questions, so let me introduce them for you. So first we have Anna Wood, who is a second year. Anna, would you like to say anything?
Hello, sorry, I'm trying to get a good link to the agenda and I just cannot figure out tinyurl. So it should be just tinyurl/medmentors12, but I'll work on that in the meantime. My name is Anna Wood. I'm an MS2. I'm in many of these sessions, so you've probably seen my face before. I went to UC Berkeley for undergrad and yeah, excited to be here today. I will mostly be in the Q&A answering your questions over the keyboard, but I may pop in now and then if I have anything to contribute in person. So yes, I will see you all during the session.
Thanks, Anna. Next, we have Austin Burroughs.
Hi, everybody. I'm Austin. I'm a first-year medical student here. I'm originally from Sacramento, California, and I went to Macalester College, which is in Minnesota, for undergrad.
Wonderful, thanks. Next, we have Holly Huang.
Hi, everybody. I am Holly. I was a transfer student to UCLA, went to community college, and then after I took a gap year, so I can give perspective on that. I went to UCLA, so I can also provide some specific information on clinical opportunities here.
Awesome, thank you, everyone. And so, like I said, we're going to talk about shadowing and clinical volunteering experiences. And this is a very hot topic right now, given the fact that COVID is still going on. So shadowing and volunteering has been a little bit harder, not only for, I know, people applying, but also for us in medical school. So this will be a good conversation today. So we want to start off by talking about how did you guys get involved in shadowing and clinical volunteering experiences? And you guys can just chime in and answer questions. I know it's just the two of you, so I might, help out too, if anything.
I can go ahead and start. So it's actually really intimidating, in my opinion, to get clinical experiences here at UCLA. Every single club that I know of that provides some sort of clinical opportunity has some sort of application process, some more competitive than others. And the way to kind of get involved is first, I'd say go attend the enormous activities fair, which will probably be virtual this year, which could be a nice experience because when it's in person, it's hard to hit every single one that you want to. Perhaps virtually, you're able to see, have a pretty comprehensive view of all the pre-medical/clinical experience clubs out there. Of the clubs that are out there, there's also a lot of different types. So some are more for giving you a shadowing experience and you don't do much. And then some are more for clinical research. So as you're collecting data, doing clinical research, you have exposure to the clinic setting. And there's a lot more other types of clinical experience, like global health experience and whatnot, which I wasn't super familiar with. And then outside of UCLA, there are also programs that you can get engaged in. So I'll let Austin talk a little bit about his experience, and then I am happy to kind of give some specific names. And if I can pull up a list, I'll share that as well.
Thanks, Holly. So I went to a smaller kind of liberal arts college, so it wasn't really affiliated with any sort of hospital. So in order to get involved in volunteering and shadowing in undergrad, I had to kind of branch out and just reach out to local hospitals. And I think there are a couple ways to do that. You can kind of start broad, just look at the local hospitals in the area, and then do a little bit of digging into each one, see what sort of volunteering opportunities they have, and find when you're interested, and then just reach out and see what the availability is to start. A secondary option is to kind of network a little bit, just see what sort of doctors you know. It can even be your primary care doctor that you see, to see if there are any availabilities in their clinic that they work at, or if not, maybe they could potentially connect you with somebody who does have availability. So when I was in undergrad, I tried both methods. I ended up volunteering at a children's hospital nearby in Minneapolis, which was a really great experience. But I wanted a little bit more, so I actually took 3 gap years before starting school to work in a clinical setting and do research, which provided me the opportunity to do both in terms of shadowing and working in a more clinical setting. So I think in my personal experience, it is good to try and get an early start, but it doesn't have to be right away.
Kind of going off of that, I went to the University of Michigan, so it's like a big university health system as well. But my experience was that like when I applied to volunteer at the hospital, a lot of times they just had us doing, very basic work, but it wasn't as much clinical volunteering experiences, which I thought was more important for medical school. So I looked for more specialized programs. I did like a hospital elder life program at Michigan, which they have similarly here at UCLA called companion care. So I thought that was really nice. If you guys want to you should focus more on programs. I think if you find that general hospital volunteering isn't that helpful in getting that experience. But I did more end of life care and working at hospice too. Um, and that was, outside of, general application process to volunteer at the hospital. So I recommend that the students go and look at different avenues rather than just general hospital volunteering.
Yeah, so kind of going off of that, you might be wondering what exactly constitutes a clinical experience. And I think a good rule of thumb that I've heard from many sources is that if you can smell the patient, then you are engaged in some sort of clinical experience. So that could be just passively shadowing, but like Christina said, I think it's a lot better if you are playing some sort of role in the care team. So for me, sharing my experience, so as I shared, I was a transfer student and I wasn't interested in medicine until I transferred to UCLA. And in the beginning, I went to the EAF and was massively intimidated, but I kind of narrowed down to a few organizations I was interested in and just applied. And I ultimately got selected to volunteer at Scope Patients Health Advocate, and I stayed there ever since and kind of became very involved in the organization. And that was the only clinical experience I have on my application. So don't feel the need to have to apply to a lot of organizations and get involved. I would say focus on the quality over the quantity in anything you do, not just getting the clinical experience. And as for kind of finding a list of organizations to potentially join, in addition to the EAF, you can go to my UCLA, and then I think if it's still true, on the top right corner, you can click on Campus Life tab, and then you can click on Student Organizations tab, and then click on all categories. Click on the tab that says all categories and then choose medical. So if the clubs are sorted correctly, you will see a list of organizations that are self-designated as medical, and you can go to their website and see what exactly they do, if they have any informational talks, which most of them do. So it might get very overwhelming in the beginning to attend all the talks, to write all these applications, but I think it's unfortunately something that you have to do. And then to help you with, so again, don't worry about getting into a lot of organizations, but I do recommend applying to a few, because these clubs unfortunately are competitive, because UCLA does have a lot of pre-med students. I think it has the most amount of pre-med students of all universities in the US. We have a lot of clubs, but also we're very saturated with students. So apply to multiple, so in case you don't get into one, you can participate in another. And then don't feel discouraged if you don't get into any. You can always apply again in the future. And then I'm going to link, so I wrote a guide with a friend, and it's geared for Chester students, but there is a clinical there's a clinical component to it, and it's not an exhaustive list. So if you want an exhaustive list, you should go to my UCLA instructions, which is also in the guide. But we kind of listed it by competitive to not as competitive clinical experience and linked their websites. A lot of their applications are open, so make sure to check those out and be mindful of the due dates and the deadlines if you do want to get involved immediately. But there's completely no rush to get involved. If you're a freshman, I'd say if you don't want to get involved immediately, completely fine. Focus on your classes first.
And then, and some follow-up questions for this this general topic. When did you guys start getting involved in shadowing and clinical volunteering experiences? And what do I do if there are restrictions for undergrads in these fields or in these topics?
I can take that one. So I didn't get involved until my senior year of undergrad, actually, in the second semester. And once I did, it was just a once weekly thing. And that's part of the reason why I took maybe more gap years than is common, because I wanted to just get a deeper experience. And I think that touches a little bit on what Holly was saying, where I would also echo that like more longitudinal or deeper experience in one site or one clinical experience is probably going to be more fruitful than just like a bunch of intermittent or less intense commitments, because I ended up bonding a lot with the staff there and just learning a ton from my clinical years or clinical experience in the gap years. Holly, if you want to add to that.
Sure. So I kind of shared already. I started technically my third year in college, and I was in that organization for 2 years, and then I applied at the end of that 2 years. So overall, I had 2 years of clinical experience and only from one organization. So it's not as much as you would think, or maybe you talk to other people and they have a lot of clinical experience. Don't be daunted. I think just focus on doing your own thing and then make sure that you get the most out of whatever you are involved in.
Did you guys find that finding or getting involved in these experiences was difficult? What are some of the challenges that you guys faced in it? And this can kind of lead into our next question as well.
Sure, yeah. I think, both Holly and I had the benefit of not trying to apply during COVID, which I think is a huge obstacle. But even in sort of normal circumstances, it is pretty competitive. There are a lot of people trying to do clinical experiences, especially at UCLA, which has a pretty high rate of like pre-med students. And I think there are a couple ways a couple things that you can do. Number one is cast a little bit of a wider net than you think you might need to, just apply to multiple things. And then the other thing is, if you do get into it, really just try to make the most out of it. And part of that's going to be up to you to really just take the initiative on learning and getting involved. Holly?
Yeah, to share some personal experience, when I first started my clinical experience, I was so timid. I was so like, I had this kind of conception of what a medical setting is like, and I wasn't super proactive. My role as a patient health advocate was supposed to follow the residents around, and when the residents leave the examination room, I stay there and provide resources for the patients and do kind of an intake, a social history intake to see if they are in need of any resources. But when I started off, I was very timid, and I remember I was just standing in the corner, not wanting to bother the residents. And in hindsight, it was very futile, because I was there to do something meaningful, right? And if I don't advocate for myself, I don't have the opportunity to advocate for my patients. And then why was I even there in the first place? But if you are starting a clinical experience and you're very scared, timid, that's okay. But kind of remind yourself why you're there in the first place, and then be as proactive as possible for whatever duty you have, but also for your own learning. So you can passively shadow, but you can also, when the situation is right, ask questions about anything that you've seen, or when the physician has downtime, you can kind of engage in a dialogue about, oh, what just happened? Why did you do this? Why did you do that? And in my experience, most doctors are very receptive to it. And in fact, they are very excited when students are very engaged in the clinic.
Yeah, definitely. I think there are multiple ways to take more of an active role, even if you are shadowing, which can sometimes be passive. But a couple tips, like when I first started, I worked in a cardiac arrhythmia center. So they deal with a lot of heart abnormalities and rhythms, which is pretty subspecialized. And when I first got in there, I really had no idea what they were talking about. There were so many medications and terminology and things that I had never heard before. And so I just started keeping like a little notebook. I would just write down a term or a medication, drug, and then Google it later, which helped a lot. But the other thing I did is just kind of wait for a moment where, say, a physician is just walking down the hall, or a resident is walking down the hall, even nurses or clinical staff, just really anybody who works there and is more familiar than you, which for me was pretty much everybody. Just ask them, like, don't be afraid to just say, hey, I know we were talking about this earlier and I didn't understand what this was. Can you just explain like why you would use this medication, or why they chose to take this treatment course versus that one? And in my experience, pretty much everybody was really receptive and welcoming, because I think, especially with physicians, they all know, even though they are busy, they know what it's like to be a pre-med and a medical student and kind of go through the whole course to get to where they are. So they're pretty willing to help, unless they're running to the emergency room or something.
Especially like if you're in an outpatient clinic, the physician has already kind of agreed for you to be there. So they're already excited for you, to be in this environment learning from them. So I would urge all like the students to, reach out and be proactive, because then you're kind of setting up a relationship between you and the physician, and it's kind of in some way networking. So if you want a recommendation letter later on, you could ask for one, or you could ask them, hey, like, I'm really interested in, a different field. Do you know a physician that you could refer me to? And honestly, like, a lot of the opportunities that people find sometimes are just through word of mouth. So, forming that relationship and being engaged, usually like physicians will, go out of their way to help find you a position that might not formally, be on a website, and then they can like help figure something out for you. So sometimes like that's how things fall. So just being proactive, being engaged, and like always putting your best foot forward.
Mm-hmm. And kind of adding to that, you might have heard that UCLA is pretty strict with shadowing. So unless you are getting your shadowing experience or clinical experience through an approved student organization, chances are if you just cold email physicians, they're kind of bound by the rules to say no to you. So that's something a little bit frustrating about volunteering or shadowing at UCLA or UCLA affiliated hospitals and clinics. But I think it is good for the patients to have that regulations, right? Kind of what Christina was saying. So sometimes you can go kind of the backdoor way. So if you do a research project, and your research project involves working with some MDs, and you build a good rapport with them, sometimes they like don't mind, they know you, they can get paperwork cleared for you so that you can just come into the clinic and kind of informally shadow them. And these informal experiences you can still list on your application. It doesn't have to be through like some formal program or anything.
Yeah, and like even if UCLA has regulations, UCLA physicians know private people, and there aren't regulations on shadowing physicians in private practice. And there's always private people that are contracted with academic institutions like UCLA, the medical community is very small. So just like, networking is very key, I think.
Yeah, and if you don't live around here and then you have like summer break or winter break, feel free to just shadow or have your clinical experience around your hometown. You don't have to do that at UCLA because you go here. Any sort of experience anywhere is great.
Okay, I think we can move to our next question. So we kind of already touched on this, but how did you make the most of your shadowing and clinical volunteering experience? So kind of going in, what's the goal of shadowing versus what's the goal of clinical volunteering?
Sure, that's a good question. For me, I think shadowing is a little bit more passive, where clinical volunteering is you're sort of performing some sort of service for the clinic, and those services or roles can vary from one specialty to another. So when I volunteered at a children's hospital, I was mainly just playing with the children, reading to patients, doing things like that. But then when I worked in a clinical setting, I was doing research, and I was able to shadow doctors in both environments. And shadowing, I would define as more like you walk with the physician or nurse or clinical provider to the patient encounters where they ask them questions and treat them, and you're less active in that setting. And as far as making the most out of both volunteering and shadowing, I think we talked about this just a few minutes ago, but really taking the initiative and learning. And I think the goal for shadowing and gaining clinical experience isn't necessarily just to put it on your resume, although that does help. I think the goal is to really figure out if medicine, and potentially what type of medicine is something you want to devote your whole life to, because it's a pretty demanding career, and knowing that it's for you is really essential in making it part of your life. And so I would say that it does help with the application, but that's, for me at least, it's not really like the primary motivation. The motivation is to learn what a day in the life of a physician or care provider is, and that can be seeing how a physician would interact with the patient, learning effective communication when they potentially deliver bad news or talk about the next step in providing treatment, and working with other care providers, because that's another thing that I really learned in my experiences, is that the physician doesn't do everything. Oftentimes it's the nurse or the medical assistant who's doing the bulk of the visit. So learning how to work as part of a team and seeing how those team members all interact and perform their various roles was really huge, in seeing just how many people are involved in providing care. And that was something that went a long way, and something I wouldn't have learned had I not shadowed and volunteered.
That was great. Nothing else, nothing much to add. Austin talked about using these clinical volunteering experience and shadowing to kind of see if medicine is a thing for you and whether you can see yourself in their shoes. Not just a physician, but any other healthcare professionals as well. I initially joined Scope Patients Health Advocate because I was kind of interested in becoming a social worker, and our role I thought was very parallel to what a social worker does, a medical social worker does. And through that experience, I also saw what a physician does, and I was very enlightened. And if you know for sure you want to go into medicine, then treat these experiences as what are some very awesome character traits or skills that these physicians that you are shadowing or seeing have, and how can you cultivate those traits now so that you can be the kind of person and physician that you want to be in the future. Kind of treat as more of a personal development process, less of a like put it on the application and then done for kind of thing, like Austin was alluding to earlier. And then So my experience, I only have that one clinical experience, but because there was a more shadowing component and a more care providing or service providing component, I was able to just split my hours. So let's say I had 200 hours and I kind of estimated 100 was in the shadowing, 100 was in the volunteering, and then put that as 2 separate activities on my application. That's completely fine too. So so those are like kind of down the later down the road decisions to make, but you don't have to really like try to find a perfect multiple experiences for your application at this stage. Just explore for now. Yeah.
Kind of going off of both of them, I do think at the end of the day, though, clinical volunteering is a little more important when it comes to the application cycle, though, just because I think Anna touched on this in the Q&A. Shadowing is very passive, and I think that especially like when you interview too, physicians and interviewers are going to ask you like why you want to become a doctor, not only in your writing. And I think that you can only really strongly talk about why you want to be a doctor if you have had clinical volunteering. Just because watching a doctor, talk to a patient is very different than you yourself talking to a patient. And you yourself talking to them, that's when you experience, the challenges in communication. And that's when you really figure out if this is something that you want to do. So also, not only that, but as I guess for me at least, when I was writing my essays for school, that's where I drew, most of the content from, is like these clinical experiences. And that's how I was able to explain why I was passionate about medicine, because I was able to, build relationships with certain patients, or I had experienced challenges in these experiences. So I think if you are struggling to get one or the other, I think that clinical volunteering, at least in my opinion, is a lot heavier in weight.
Yeah, I absolutely agree as well. I think these patient interactions and these stories that you hear from these patients should be the motivating factor or deciding factor for you to enter medicine. And I think you can have a huge variety of experience, and don't be discouraged if you feel like you're kind of doing something that you're not, like something that you're like, don't feel bad if you don't feel super engaged in your clinical experience. So like if you're playing with kiddos, then you're like, oh, why am I just playing with kiddos? You can kind of think about why you're there in the first place. You're kind of, depending on the program, you're playing a critical role in the program, right? So use that to motivate you to continually engage and have have a pretty substantial and longitudinal experience with whatever programs that you're in.
And then I know we talked about like obstacles, like how to get the clinical, like the experiences, but did you guys have any obstacles while in the experience itself, other than like, being a little lost with understanding? But were there challenges while you were like in your clinical volunteering or in your shadowing that stood out?
I guess one thing I could think of right now is a language barrier. And especially here in LA, a lot of patients are only Spanish speaking, and I didn't know any Spanish at the time. And sometimes I had trouble communicating with them, and like kind of because there are interpreters around, but I also wasn't sure for the role that I'm performing, the social intake, if I kind of should hog an interpreter to myself when other medical providers might need it. So that kind of evaluating the situation, the circumstance, and deciding whether to get an interpreter was something that I faced, but also was very motivating because I realized that if I want to stay in LA and continue to practice in LA, I should pick up some Spanish. So I started learning some Spanish during my gap year. Yeah.
Yeah, I think going right off of what Holly has said, I experienced a similar language barrier. But for different reasons. I worked in Boston at Tufts Medical Center, which is right next to Boston's Chinatown. So many of our patients were Chinese, and I couldn't relate or speak the language. So calling for interpreters, or even using a telephone interpreter where you speak into the phone and then pass it to them. I had to get pretty familiar with that. But I think the plus side of that is that a lot of obstacles are learning opportunities. And so had I not done this experience, I wouldn't be familiar with working with interpreters, which I think are actually a really big part of medical care, especially for if you want to serve like underserved or immigrant populations. So those experiences, I would encourage you to view them more as like learning opportunities than obstacles. It's just a chance to learn something new and get more familiar with something that you maybe haven't seen before. So take every challenge as like a positive rather than a negative.
Awesome, thanks you guys. Okay, so I think this is a good transition for the next question. How important is shadowing and clinical volunteering for medical school applications? So we already touched on this a little bit, but going a little deeper, do you have to do shadowing and clinical volunteering to get into med school? How should I keep track of my experiences to write about them later? Should I get rec letters from doctors and these healthcare professionals? And how many hours do I need?
Lots of questions in over there. So in addition to clinical volunteering and shadowing, there's also clinical employment. So if you work in a clinical setting, so that could be a front desk where you like interact with patients and do their intake every day. That could be working as a medical assistant, or if you were a nurse, that was your clinical employment opportunity. So I'd say you kind of need to have at least one of those three in order to show medical schools that you have some sort of exposure to medicine. And I would kind of find it a big red flag if you don't have any clinical experience and want to apply for medical school, because I would be unsure of your motivation if you haven't be in the clinical setting, talk to the patients. Yeah, and you can keep track of your experiences. What I did was I just had a Google Doc, and for the activities that I had, I just listed them. And then some organizations have the hour system built in, so you have to clock in and clock out every time you volunteer. So those are easy because they just keep track of hours for you. But for the ones that don't have that, then you kind of need to just track the hours on your own on a sheet or document. Shouldn't be too difficult. And as for rec letters, I'll let Austin kind of touch on that. No? Okay. As for rec letters,
go ahead.
Okay, sure. So it's not mandatory for you to have a rec letter from this experience. It kind of just depends on how meaningful that experience was to you and how engaged you were and how well your supervisor or whoever your letter writer got to know you throughout the experience. I'd say maybe you could, of all the extracurricular stuff you have on your application, maybe have at least one letter writer from those, because those, in contrast to professors, kind of have a different perspective of you as an applicant, right? They worked with you on a more personal capacity. They know your characteristic more. They know a lot more information about you other than the academic capabilities, which are kind of what your professors would write about you for. And how many hours do you need? You don't really have a set number of hours that you need, but I think the key is being able to talk about it, to write about it in a very deep extent, and also to be able to talk about it when it comes up during your interview. So however many hours that is for you, but you don't need to feel like you have to get 1,000 hours or some crazy numbers like that.
I think those are all great points, Holly. I think as far as like the number of hours, I would, you know, it's a little bit cliche, I guess, but it's not really about like the number of hours, but the depth of experience. So if I think a good rule of thumb is like, if you do want a letter of recommendation from somebody that you did that experience with, a question you can ask yourself is like, is this experience, did I do enough to have that person be able to speak like meaningfully about me? So for example, if you just volunteer one Saturday at a free clinic, a doctor at that clinic probably wouldn't be able to write a meaningful letter of recommendation for you because they don't really know you that well. On the other hand, if you volunteer for a whole school year at a clinic every Saturday or once a week, and you work closely with a clinician, then they probably could write a letter for you. So I think a good perspective that helped me is not necessarily what what that experience could do for me, but what I could do for that experience, that clinic, that site, and if I am able to play a meaningful role and contribute meaningfully, then those clinicians will be able to do the same in return. So it's not necessarily how can I do the minimum work at this experience to be able to put it on my resume, but how can I get something meaningful out of it? I think that's the top priority. And then I think I forgot the other questions. There was a few, but I think Holly did a great job of summarizing those.
Yeah. Also, like, I don't think that a school has at least like on our end, since we're not on admissions, I don't think a school has a specific cutoff on the number of hours. I know for like PA school they do, for like clinical experience, but for medical school, especially when it comes to volunteering, kind of going off of Austin, so like if you do a good amount at a place and you're really engaged, you'll really find like a lot of different experiences in which you can like talk about it. You can get recommendation letters, and it's just a lot more meaningful. And whereas I feel like if you do a lot of small volunteering things, like help me out at a fair like once or twice, if you put it down, it kind of just seems empty. It's more like it just comes back to like the quality versus the quantity. So like if you are super involved in a club and like always work at the health fair, so you can definitely talk about that, but I would more so discuss that as like one event that you, like if you did it 5 or 10 times like over a few years, list that as one event and how you were involved longitudinally. Like, I think that's a better way to present it. Showing how, not only were you involved on the actual day of the fair, but did you help, organize it and things like that? Did you help with the administration or like, so I think at the end of the day, you really want to do activities where you can become very involved and engaged, because when you interview and when you write your essays, that's where your conversations will stem from.
And oftentimes, kind of linking to struggles in these clinical experiences, it's very easy to treat it like a chore, right? You go in, you go out, and the next week you go in and you go out, and then the next week you do the same thing again. And I think it's very important to kind of be very engaged in each opportunity that you do have in the clinic, and be constantly very reflective about your experiences. And one of the questions was, how should I keep track of my experiences to write about later? So as you're going through, or as you're engaged in your clinical experience, if there are any instances, any patients that you met who kind of who inspired you, or showed you a different aspect of medicine, or kind of gave you a new idea that you never had before, feel free to just document them out for yourself. It doesn't have to be shared anywhere, just so that not only you can see your progression of your viewpoint in medicine and your role in medicine, or your role in that particular experience, it also can come in handy when you write about that experience in your application later on.
I think just going right off of that, those type of examples make for really great application essays, where you say, because of this experience, my perspective on X, Y, and Z changed for the better, and here's what they are coming into medicine. and then they could potentially, be part of a personal statement where you say, because of this experience, this is why I want to go into medicine. So, the longer and more committed you are to that experience, the more likely you are to get something really meaningful out of it. And I think if you are able to get something meaningful out of it, then the rest of the stuff will kind of follow. You'll be able to write about it pretty easily in your applications and talk about it in interviews when the time comes.
Also, like when you're on these experiences, don't only focus on your experience with the patient, but also like think about what it's like to be on like the medical team, because being in medicine, it's very important to be a good teammate, and have everyone contribute. So I think, at least for me, I talked about how much it was like how much I enjoyed being on a medical team and like working with people from all different careers in one patient's care. So like Holly said, like writing down how you feel, not only with the patient, but also like how do you feel working with the nurses and the doctors and the techs, because those are all very important feelings. And if you don't write them down, then it'll be super hard to remember them when applications roll around and you're very stressed out. So
it is very stressful indeed. And I know we talked a lot about getting like very involved and quality over quantity and have longitudinal experience and whatnot. And some of you who are in like experiences that you hate may be freaking out right now. But I want to also encourage you to not be afraid. So your reflection doesn't always have to be positive, right? So if you have encounters that you didn't like, kind of figure out why like this particular experience didn't sit well with you, and then use that to guide perhaps your career choice or perhaps another type of experience in medicine that you will enjoy a lot more. So don't be afraid to experiment if you haven't found one that you really like or found a mission that you really resonate with. But when you find one, then be very engaged and do as much as you can in that particular experience.
great. Okay, so I think for the last 15 minutes, we can just answer some questions in the Q&A, because that's all of like the planned questions. So I think one question that I think is on everyone's mind is, if we end up being online for the whole year because of COVID, how are some ways we can still get experience, while being online?
It's hard. So for the, oh, sorry, are you going to say something?
No, you're good. You go first. I'll chime in on this one too.
Awesome. I have a very limited perspective on this, but when the Scope Patient Health Advocate program, they're kind of transitioning to providing remote resources for patients. So you're not kind of interacting with patients directly, like you can't smell them, but that's okay. Like it's okay for us to not smell people during this COVID time. But if you're still helping people in some way, it's completely okay. And I think a lot of organizations are kind of trying to brainstorm ways to still cater to our patient population in this time. So case by case basis, check out each organization, ask them questions, go to their info sessions to find out.
Cool. Okay, I'll chime in a little bit too. I totally agree with that. I think like a lot of existing programs are trying to adapt to these like virtual times. So it is very difficult, but like maybe if you're involved in some student organizations, like you can even be part of that transition to virtual times. Like try to think about different ways that you can adapt, that you can still reach out to patients or whatever community you're working with. Like there you hit leadership, you hit like clinical volunteering all in one fell swoop. Also, there's one website I had heard about through Instagram. Actually, I'm looking it up right now because now I'm blanking on the name. But there are virtual shadowing experiences. I don't know that they're like equivalent to shadowing in person, but since shadowing is so difficult to get right now, it may be worth looking into, just seeing what the experience is like. If it's a good experience, I haven't done it, so I can't speak to that, but just like another thing that you can kind of look into. And it's called, well, I'll put it in the chat when I find it. But yeah, there are ways to get involved online. Things like tutoring over Zoom, like different volunteering kind of methods can be adopted over Zoom. So you may want to look into those types of opportunities. But yeah, I think schools understand that it's really difficult right now. So you won't be like penalized for not having as much as you had hoped or as much as you had wanted. In terms of like shadowing or clinical experiences, just do your best, keep looking for those opportunities, and yeah, get them where you can.
Also, for the students that are planning on taking some gap years, one way you can kind of go about this is doing paid experiences like scribing. Um, that like you will get training, COVID training to be in a clinical setting. And in these positions, you can talk about, your clinical experience. It doesn't have to be exclusively volunteering. It can be a paid experience. Same is like if you are like a nursing assistant, you can also do that as well. But kind of like going back to the beginning of the talk, I'm not entirely sure if a lot of the volunteer programs are still going on, but like looking into, you know, hospital elder life care. It's just like I don't know if it's still going on because COVID and like the high risk of older patients, pediatric care. There's a lot of different like organizations that you can like look into within the hospital. But at the end of the day, if you can't find anything, the paid experiences are still there.
Yeah, kind of adding to that, I think there are a lot more paid opportunities related to COVID, kind of in all capacity, like volunteering or working at like testing sites or intake for COVID patients and whatnot. I do know some friends of mine who are in gap years right now, kind of applying to those kind of jobs. So if you're like lucky enough to be not like in the high risk population, and if you're like privileged to not have to worry about getting sick, then that could be something that you can look at as well. But like Anna said, don't worry. I think all the schools understand. It's okay. Like although I'm a medical student now, I also cannot shadow. And it kind of sucks because I wanted to like check out other specialties and see what specialties I would be interested in. And even as like medical students who are completely, we did all the onboarding process, we still are not allowed to shadow either. So unfortunately, this is just how it is right now. Hang in there. We'll get through it together.
Yeah, I think just to add on to that too, like definitely just keep persisting. If you don't get the first opportunity, just keep trying. I think in my senior year of school, I applied to like 15 or 20 jobs and got one of them, and that was the one I did. So just keep going. And I think even if you take medical school as an example, like acceptance rate is pretty low, but it only takes one. So just keep working for that one.
Yeah, and you can do like EMT as well. I know like a couple of my classmates were EMTs before they started medical school, if scribing doesn't interest you. So just like look into those opportunities. One question I think is really good since we've all taken gap years is for the people that have already graduated and we don't have access to the clubs anymore, how do we go about finding, shadowing and clinical volunteering?
So some clubs do take alumni. So that's kind of on a case by case basis. I don't have the list with me, so you might have to inquire each organization to find out. But otherwise, you can look into just independent programs. So things like I think Cope Health Scholars. They prior to COVID, they provide experience for all pre-med students regardless of your education status, and as we talked about earlier, paid experiences, which is probably the best idea because it's like we have to make ends meet as well during our gap year. So it's good to get paid while engaging in these clinical experience.
Do you guys think that there's a reason to go for either a paid or unpaid position?
I mean, going off of what Holly just said, the incentive for going for a paid position is you get paid to do it at the baseline. But I think more often than not, the paid positions will be more involved. And like we were talking about earlier, a more involved position where you are contributing to something to the clinic rather than a more passive shadowing experience will probably be more helpful in terms of teaching you things, but also potentially giving you things to talk about in your applications, and also just giving you a more well-formed and perspective about medicine and why you might want to do it, and maybe what type of medicine you want to do. So those paid experiences will probably be a little bit more informative, I would say.
And there's also typically a lot, you need a lot more time to commit to. So if you're like a full-time student, sometimes it won't be realistic for you to take on a full-time job or a part-time job along with your coursework. And I think so if it's a volunteering experience, especially when it comes to clinical research, you may have more autonomy as to what you want to do, because I know that when you become a research tech, sometimes, depending on the job, could become kind of routine, or you just do the same thing again and again. Whereas as a student, you typically have like a project you're working on, and you can just focus on that project. Definitely not the case for all volunteering clinical research positions, and definitely not a case for all paid clinical research positions.
Kind of going off what Holly said, yeah, a lot of the paid positions it's like a job. So this is something that you'll be doing in your gap year probably. So for me at least, like I had a research job during my gap year, so I did unpaid volunteer positions. So it's like kind of like how you want to balance your schedule, because if you do unpaid, then you can do it on your schedule and your terms. You have no tie to it. Whereas with paid, I know if like the amount of money is important to you, a lot of times like the paid volunteer experiences don't pay as much. So that is something to keep in mind, like depending on where you're living in the country in your gap year, if you're living at home, and like if the income amount is enough. Because I know it would probably be around like $20,000. Yeah. If there's any questions that you guys see in the chat box that you want to answer out loud, we have like 5 minutes left. Okay, I think this is good. Someone asked, I saw earlier, is shadowing a doctor any different than shadowing like a PA or a nurse? Can you talk more about that?
Yeah, so I think it depends on the clinic. So some clinics will have different roles and responsibilities for different providers. For example, in the clinic that I worked in, the cardiology clinic, we had a physician assistant who was really involved. She was involved in performing procedures like implanting pacemakers. She saw patients. She did pretty much a lot of the same things that physicians do. So in that case, if you were to shadow her, it would be pretty similar to shadowing a physician. But that's only one example, and it might vary from clinic to clinic. Shadowing in somebody like a nurse practitioner, they are really they carry a pretty heavy load in terms of just seeing patients. So if you really want to get a lot of patient exposure, shadowing a nurse practitioner would be great. But I think at the end of the day, each position has different roles and responsibilities, and that's why they are different positions. So if you do want to shadow a physician, that's great, but it's not the only option.
Yeah, and kind of going back to like the whole healthcare team, I think, like just you being in a clinical setting is already one big thing. It's not easy to. So I don't think like you shadowing a doctor or you shadowing a nurse is that like it doesn't really show you that much more. Um, yeah, you can say like, oh, I want to become a doctor because I want to like take care of patients, but like nurses take care of patients just as much. And honestly, like when I would talk about the shadowing experience, I think it's more about like how you see like a relationship is built between provider and patient rather than like the role that the person has. Um, and then someone asked like if shadowing a medical student counts, and I don't think so because medical students don't really know anything. So no, I don't think it would count.
I agree. We basically know nothing. But a student asked about the timing of applying, and I think this would be helpful information. So when you apply, I took one gap year, but when you apply, you can project the end date and project the hours that you'll have prior to the time you matriculate. So let's say you know that you are going to work, like for sure you have been accepted to work, like let's say a clinical position starting like in June or something. So right when you apply, you can just do a rough estimation and write about it in the experience as something that you'll be starting soon. So yeah, that's how you would account for experiences that you're having in that last gap year of yours.
Okay, we just have a couple more minutes left. If you guys like 2 more minutes left, I think this is a good time to wrap things up. If you guys go to the tiny URL that Anna put in earlier in the chat, we have a link at the end of the first page. If you guys can fill out the feedback form for us, we would really appreciate that, just so we can make the sessions better every time for you guys. And if there's any other questions, I'm sure you can put it in the form and we can, get back to you on that. Also, if you look on the form, we do have one-on-one appointments with medical students here at DGSOM. So if you want to chat with any of us for 30 minutes to get help on essays, interviews, just general advice, we are here for you. So just stay tuned and we will be back in the first week of October, I think, because both the first and second year class has exams coming up. So I think this wraps it up. Thank you everyone for coming.
Thank you so much, everybody. Good luck with your exams, and we'll see you back in October.
Thank you guys. And just to address some of the other remaining questions in the Q&A,